Hi, how are you?
Good, thank you.
What's your name?
My name is Daisy.
Hello, Daisy. My name is Jeanne. I'm a family nurse practitioner student at LIU. I'm here to do your annual assessment. So, is that okay with you?
That's fine.
First, I'm going to wash my hands and I'm going to do your vital sign. What I will ask you, I'm going to tell you 3 words that you're going to need to remember because I'm going to ask you later on during the exam, okay? That will be table, chair, and telephone, okay? All right. Okay, I'm going to take your blood pressure. Sorry. One from 60. Okay. Take your pulse. Very good. That is 68 and your respiration is 18. Okay. Now, can you tell me the 3 words that I told you earlier?
Table, chair, and telephone.
So, do you know who is the president of the United States now?
Joe Biden.
Okay. So, I'm going to continue with the rest of the examination. Okay. If you feel uncomfortable or if you have any question while I'm doing it, please let me know. Okay. First, your head is midline to your body. It's very good. I'm gonna palpate. Tell me if you feel any tenderness.
No tenderness.
Okay. No pain. Air distribution is equal. Okay. No sign of flies. No tenderness. Very good. Your eyebrow are symmetrical, your lashes are curled up, your skin is very nice. You know, your nose is midline and there is no inflammation or cracks on your lips. Everything looks good. That is very good. Okay. I'm going to palpate your lymph node. Okay? I'm going to check. Let me if you feel any tenderness. Okay. Your maxillary sinus, any tenderness? Okay. I'm going to palpate your lymph node. Let me know if you feel any occipital, posterior cervical, interior cervical, your tonsil. You can keep your head down, relax. Submandibular, mental. Okay. When I'm here, I'm going to check for your trachea. You can relax. Your supraclavicular, superior, inferior clavicular. Okay, everything looks good. So far, so good. You can open your eyes. Okay, I'm going to conduct a series of tests. You can look at me. I'm going to use the light, and I'm going to check to see how your consensual light, your eyes is reacting to light and everything. Just look at me, okay? Okay, very good. Your pupil are equal, round, and reactive to light. And I'm going to check for accommodation. I'm going to ask you to look at my finger. I'm observing. I want you to look at my finger and look far at the same time. Okay. Now I'm going to ask you to only use your eyes. Don't turn your head. Just look at my finger. Okay? Okay. Cranial nerve number 3, number 4, and number 6 are intact because the eyes was able to go up and down on the side. That's oculomotor, cranial nerve 3, and the side to side is the trochlea and adjacent. They are all 3 are intact. Okay. Now I'm going to check for your optic nerve, that cranial nerve number 2, and is check with the Snellen chart. I'm going to ask you to look at here and cover one eye with your hand and with this line for me.
LTFPH.
Okay, cover the other one.
LTFPH.
Okay, cover it. What color is that?
Red.
What color is that?
Green.
What color is that?
Green.
What color is that?
Red.
Okay. Cranial nerve number 2, which is the optic nerve, is also intact. And now I'm going to check for your cranial nerve number 1, which is the olfactory. I'm going to ask you to cover one and breathe. Very good. Do the same with the other one. Very good. Now I'm going to ask you to close your eyes, and I'm going to make you smell something and tell me what you smell. Okay? Mm-hmm. What do you smell?
Coffee.
Okay, that is cranial nerve number 1, which is olfactory, is also intact. Okay, so now what I will do, I'm going to ask you to frown. You're already doing it. Can you smile? Frown. Okay, so that is cranial nerve. Can you put, okay, all right. Now, can you shoo? Okay, can you go like this? Okay, all right. Okay, cranial nerve number 5, which I check for the TMG, is intact, and also cranial nerve number 7, which is the facial nerve, while she smiled and frowned, is also intact. And I will check the sensory part of cranial nerve number. Okay, I want you to close your eyes. I'm going to touch your face with something and tell me what you feel. Mm-hmm.
Soft. Soft.
Mm-hmm.
Dull. Dull. Sharp. Sharp.
Very good. Now, what I will do next, I'm going toward the back and I'm going to whisper something on your ears, and you're going to tell me what you hear. And I'm going to ask you while I'm in the back to hold this water, and I'm going to ask you to check. That's when I will check for your thyroid also. Okay, while I'm in the back.
99. 1, 2, 3.
Okay, now I'm going to ask you to swallow for me. Checking your thyroid. Swallow. Okay, very good. All right. I'll take the water for you. Thank you. Now, I did the whisper test. I check your cranial nerve number 8, which is the acoustic, and is also intact. Okay, so I'm going to perform what they call the Weber test. I'm going to tap this and I'm going to put it in the middle of your hand and let me know if you hear the vibration that you're the same in both ears.
The volume is the same in both ears.
Okay, now I'm going to conduct the Weber test and then you tell me. Okay. Tell me when you're longer.
No longer hearing it. No longer hearing it.
Okay, I'm going to do the same here.
No longer hearing it. No longer hearing it.
Okay, good. All right. Now, I'm just going to use this. I'm going to look at the fundus of your eyes to make sure that there is no bleeding. And I'm going to get a little bit closer to you. Okay? All right? And to feel the red reflexes. Open your eyes, please. Okay, no sign of hemorrhage or bleeding. Just look at me. Look at me straight. Okay, very good. Very good. Now I'm going to change this. Okay, I'm going to ask you to lift the tip of your nose and I'm going to look inside. Okay. Okay, it's pink and moist, no leaking of any fluid, and then the septum is midline. I'm going to deviate. All right, I'm going to continue while I'm here. I'm going to use a blade. And I'm going to ask you to open your mouth. I'm going to check your gum, your teeth. Open your mouth. Okay, the palate on top is, say for me, Okay, the tonsil are moist and pink, no wetness, no sign of gingivitis, of all teeth are white. I want you to stick your tongue out for me and turn it to the left and turn it to the right. Lift it up and down. Okay, and say take it out. Okay, now that's telling me that cranial, it's okay. It's okay, you can put your head down. Relax a little bit. That's telling me that cranial nerve 9, 12, they are intact because the patient is able to swallow and lift the tongue left and right, and there is no issue. Cranial nerve 10 also is intact because patient got gag reflex, which is the vagus nerve. Now, the last thing I'm going to do with the light while I'm here, I'm going to check your ears. Okay? Okay. So don't worry. I'm going to pull the ear up and back. I'm going to look inside. Tympanic membrane is pearly gray. It is very clean, and cone of light is at 5. I'm going to check the other one. Tympanic membrane is pearly gray. Cerumen is the right color for ethnicity, and cone of light is at 7. No sign of infection or bulging. Very good. All right. Now we're going to continue to perform a number of tests. Now, what I will ask you to do is I'm going to listen to your breath sounds. I'm going to go toward the back. We're going to do some more tests, okay? All right. I want you to take a nice deep breath and just relax. I'm just listening to your breath sound, okay? I'm going to listen with the diaphragm of the stethoscope. Now, I'm going to put my hand on your chest and I'm going to ask you to repeat 99.
99.
I was just checking for tactile phrenology and also examining the front. Skin is perfect. There is no sign when I did the palpation, no sign of any mass or inflammation on the chest. I'm going to do the same in the back and I'm going to ask you to repeat certain things, okay? I want you to, yes, sorry, leave your gown and look in here in the back. Sorry, I'm going to move your hair to the side. Thank you. Just relax and I want you to take nice deep breath for me, okay? So I want you to say 99.
99.
Okay, 99.
99.
Now I'm going to measure chest expansion. I'm going to turn the bed just a little bit so the camera can see. I'm going to put my 2 hands. I'm going to ask you to take a nice deep breath in and out. Again. Again. Okay. Chest expansion is bilateral, equally bilateral. Now I'm going to ask you to repeat E.
E.
Mm-hmm.
E. E. E.
I want you to repeat 99.
99. 99. 99. 99.
Good. Very good. Okay, now you can just take nice deep breath. No problem. Take a deep breath. Mm-hmm. Okay, while I'm here, I'm going to check for CVA tenderness. I'm just going to tap the back and patient will tell me if she feel any tenderness. Do you feel any tenderness?
No.
Any tenderness?
No.
Okay. while I'm here also, I'm able to, not completely to assess the spine, but I'm able to see there is no type of tenderness. You feel any tenderness on your spine? No tenderness? Okay, very good. Okay. Now, I'm going to ask you to lay down for me and try to be comfortable. Be careful, don't fall. Safety first, okay? I'm going to cover your leg. Are you okay? Is everything okay?
Yes.
Okay, all right. So now that you lay down, I'm going to check all your pulses. And then after that, I'm going to listen to your heart sounds and I'm going to examine your abdomen. Okay? So while I'm here, I'm going to check for, I want you to turn your head. I'm checking to see if patient has any sign of jugular vein distension. If the patient had any sign of jugular vein distension, I would see the jugular vein um, protruded out and palpating, and that will also give me an indication on how the fluid and the heart of the patient is working, if she has any fluid overload, because the jugular vein distension is directly connected to the right atrium. So the way to do that, I'm going to use the ruler, and I'm going to place the ruler on the patient's chest, about here, and I'm going to take a straight paper and I'm going to put it here and look at. There is no jugular vein distension, is only the 3 centimeter, which is normal. And also I'm going to palpate for the carotid artery, but I'm not going to do both at the same time. I'm going to do one at a time. Okay? No problem. You okay? I'm going to also palpate for the temporal artery. Break your bones. I'm so sorry. I'm just gonna pull this a little down so I can feel your femoral pulse. That I do femoral pulse. I'm gonna feel for the popliteal pulse behind the knee. Dorsal. Very nice. And okay. Pulses. Okay, very nice. Okay. So I'm going to be now listening to the heart sounds while the patient is still in a supine position. I'm trying to make the patient do less movement possible. I'm going to use the bell of the stethoscope to listen to the aortic artery. It's on the second intercostal, right second intercostal. Pulmonic, third point, third left intercostal, tricuspid, fourth intercostal, mitral, fifth intercostal midclavicular, that is the apex of the heart, very clean. That's where also I would hear mitral valve regurgitation, and that's where S1 is heard the loudest. You can turn back on your body. Both S1 and S2 were audible, no heart murmur, no extra sounds. Okay, so um, while I'm here, I'm going to continue to do to listen to the aorta, to listen to the iliac artery, renal artery, and femoral artery. I'm going to use the bell of the stethoscope. I listen bilaterally for the renal artery above the umbilicus, the renal artery under the umbilicus, and the femoral artery at the groin. The first step actually for the abdomen is to inspect for any sign of discoloration. There are no discoloration, any mass, there is none like that. So everything looks good. Now I will use the diaphragm of the stethoscope to listen to vowel sounds. I didn't hear no vowel sounds. It take actually longer for me to be able to listen to vowel sounds. And if I wanted to listen to the vowel sound, I would give 5 minutes to take time and listen to vowel sounds. What I will continue to do now is to percuss the abdomen. I'm going to percuss the abdomen. In percussing the abdomen, I'm also going to measure the liver span, and I will start by doing the percussion when the sounds get too dull. I will put a mark when I get dullness, and then from the sternum out, I will also start the percussion. And I'm also going to put a mark right here where it changed. Then it's written normally, it's supposed to be 7. It's a 7 for a woman and 10.5 for men. Okay. In percussing also, I should be able to percuss the right upper quadrant where I will feel for the spleen. When I'm percussing the whole abdomen, I'm supposed to hear tympani, and which is normal, exactly what I'm hearing. There are a certain number of tests if the patient was suspecting or having ascites that I would ask the patient. I will touch and do the weight test. I will ask the patient to turn over and to feel to see if there is any change in percussion. But this patient got no indication that she has any sign of ascites. I'm going to refrain from that. Now, what I will do next, I will do palpation of the abdomen. What I can first do, I can try to touch and palpate the aorta, which is right here in the middle. And I can measure it. It's right here. Okay. And I'm going to start with light palpation. I'm checking for any mass, any tenderness. Do you feel any tenderness here?
No.
No tenderness. No tenderness. I'm going to do medium palpation, which is 2 to 3. Any tenderness?
No.
Okay. All right. Very good. Now, um, while my patient is laying down, I'm gonna. Okay, you can sit down. I think you're getting too comfortable. I want you to sit down for me now. We're going to continue. That's the part I call the workout part. We're going to continue with a few tests. Okay, what I will ask you, I'm going to ask you to close your eyes, and I'm going to touch your skin with a few objects, and you're going to tell me what you feel. Okay? What is that?
Soft. 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 Soft.
Mm-hmm.
Sharp. 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 Dull. 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 Dull.
Now, while I have my patient here, I should check circulation. Where I will check. You can close your eyes. I will check, but patient got nail polish. I'm not able to check capillary refill in the finger or in the leg. But I'm gonna do a few other tests to ask the patient. I'm gonna ask you to close your eyes and give me your hand. Tell me if you feel like I'm going up or down.
Up. Down. Up. Down. Up. Down.
Okay, all right. So while I'm here, I'm just gonna check for vibration. I'm just gonna tap it and tell me when you start feeling it. Close your eyes.
Feeling vibration.
You feel it?
I'm feeling the vibration. I'm feeling vibration. I'm feeling vibration.
Okay. Now tell me, what is that feel to you?
Cold. 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 Cold.
Okay. While the patient is here, I'm also going to check for cranial nerve 11, which is the spinal nerve. I'm going to press your shoulder, and you're going to show me. You're going to show resistance. I'm going to touch your face. Don't let me touch it. Very good. Okay, cranial nerve 11 is also intact. Now I'm going to check for deep tendon reflex. I'm going to check for the tricep, the bicep, the brachial, and also the femur. Okay, just relax. Okay. Okay, very good. That was the tricep. Now checking for the bicep. Relax. Okay, relax. Very good. Sorry. Okay, now I'm almost done. Just be patient. I'm going to ask you to lay down. I'm going to check your muscle strength. And after that, you're going to stand up. That's going to be the real workout. Okay? All right. Okay, I'm going to ask you to bend your knee. Both of them. Bend your knees. You can put on the bed. Just try to resist when I'm trying to open. Okay, very good. I want you to go like this. Okay, try to resist. Very good. All right, so there is no flaccidity in the muscle, and patients should also show resistance. Okay, I'm going to ask you to sit for me. Okay, now I want you to close your eyes, and I want you to extend both of your hands like that. I'm going to check pronator drift. Okay, that's negative. Okay, very good. Okay, now that's the real workout now. I'm gonna ask you to stand up, okay? And you can you can close for now. I'm doing the wombat test. And I want you to turn, I want you to put your foot together, your hand on the side, and I'm standing behind the patient. I'm performing the wombat test for balance. And she's closed her eyes and I'm observing her. She got her hand down and she saw no sign of imbalance or drifting. Okay? Very good. Now, what I want you to do for me, I want you to step back and I want you to perform the heel to toe walk. Okay. Very good. Now turn around. I want you to walk on your toe. Take a few steps and walk on your heel. Okay. I want you to stand here. I told you that was a really big workout. I want you to open your hand like this. I want you to rotate. Okay. I want you to flex. I want you to extend. Put your hand to the front like this. I want you to rotate your wrist. I want you to flex. I want you to extend. Okay, I want you to do the same with the leg. I want you to rotate. Just rotate and push and flex. Very good. You do the same with the other one. Flex. All right. Very good. And how do you feel?
I feel great.
You feel great?
Mm-hmm.
Was that a good workout?
That was a good one.
Okay. You feel very good about everything?
Yes.
All right. Very good. I think you can have a seat. I'm going to finish my note. And you were a wonderful patient. I think we did a good job today.
Thank you.
Thank you so much.